Welcome to the Straight-Talk Physio Podcast with your hosts, Dr. Andrew Junak and Dr. Craig Giambattista. On today's episode, we are going to talk about 5 things you should and should not be doing right after an injury. We're going to kind of discuss the difference between acute and chronic injuries, the things that you absolutely need to be doing depending on the type of injury that you have, what you absolutely should not be doing, especially right off the bat when you have an injury, and then also when the right time is to get help. I think a lot of times patients aren't 100% sure as to when an injury is maybe out of their realm or they're unable to help heal themselves, and the DIY method doesn't work any longer. So we're going to tackle all this on today's podcast. Craig, do you want to start us off and talk a little bit about acute versus chronic injuries and what those look like for our listeners?
Absolutely. So all injuries definitely not created equal. So as medical providers, we got to categorize them somehow. So what we'll talk about today is acute and chronic. There is like a middle ground, kind of subacute, and we'll touch on that a little bit today, but for our purposes, it's kind of helpful to think of it between these two categories. So acute pain typically refers to something that it's normally specific. It typically comes on pretty quick, and usually it results from something you can kind of pick out, or like a specific incident. Yeah. More often than not, it tends to be isolated. You can kind of point to it and say, this is what I hurt, and I think this is how I did it. Typically, it's pain that can come on pretty quick, but it can also kind of be a little lower in duration. But overall, it should have a relatively limited duration, and it's typically something that you can pick out how it happened. I think one thing worth noting about acute pain is it's kind of like a severe word, so it doesn't really mean like severity. The way we use the term acute, it just means rapid onset. So sometimes when people see the word, let's say like acute shoulder injury, it doesn't have to mean that it, 10 out of 9, 10 out of 10 pain. It just means that it's something that happened, relatively quickly, and we can kind of point it out. So acute, more of a descriptor than a something that can describe severity.
Yeah.
As far as chronic pain is concerned, that's a little different, and the waters can be a little bit muddy there. As opposed to acute pain, sometimes it can come on a little slower. It can kind of develop, if you will. So sometimes you might not be able to pick out a specific event that caused it. But that's not to say that sometimes you can have a definite onset of chronic pain too. But it just tends to be a little bit more rare. As far as timing is concerned, the name chronic just kind of implies that it lasts a little bit longer than your acute pain, and typically it's persistent, or it's something that you've had in the past. So I think the big thing here, just like with acute pain, chronic is a way to describe how long it's lasting, not a descriptor of severity. So it doesn't mean 10 out of 10 pain. It doesn't mean 2 out of 10 pain. And I think a lot of times people tend to forget is if you have chronic pain or recurrent pain or pain that happens, at kind of over and over for a long period, we'll call it more than 3 months. You can have days or hours or when you're not painful at all, and then it can kind of come back later. That's still chronic pain. It doesn't mean you have to be in pain all the time. You most certainly can be, but there can also be those brief parts where you tend to feel almost okay. So I don't know, Drew, if you had anything else to add there, but that's typically the basic definitions I'll use when I'm talking pain with my patients.
No, I think you're right on. When it comes to acute injuries, I always like to think of them in that 0 to 7 day mark. Injury starts, it's still kind of inflamed. The area is tender, it's sore, versus your more chronic or reoccurring injuries where, patients will come in and they'll describe it as, hey, I get this pain in my neck, and it happens, it comes and goes, it radiates into my shoulder blade. If I do a certain workout or I sleep a funny way, it just comes back. And then after 2 weeks, it gets better, and it's just a recurrent cycle. So I agree with you. Like, as far as a chronic injury, it doesn't always have to be a constant injury for a long period of time, but it can be something that just kind of comes and goes and doesn't fully heal itself. It may for a short period of time, but then it creeps right back up when you least expect it.
Yeah, I think, great details to add there. So going along with that, let's say, you're treating a patient in the clinic, and what would you recommend if they came in for, let's say, an acute injury?
Yeah, so in an acute injury, I treat it very differently than I treat someone who has a chronic injury. Typically, if something is super acute, so we'll say between 0 and 7 days, depending on the patient's severity or the amount of pain that the patient has, I may actually tell that patient, let's hold off for a week. And in the meantime, I'd like them to price. So I'm sure a lot of people's heard of the acronym, protect, rest, ice, compress, and elevate. I'll tell them to go home and start there. Reason being, because sometimes when things are too acute and your body is still in what we call the inflammatory phase, so your body's still trying to heal itself, if we go in there and we start pushing on stuff and poking on stuff, and we run the risk of maybe irritating tissue a little bit more. So sometimes it's best to take a little break, take about a week, maybe like slow down on some of the activities that you do daily that aggravate the pain. So almost tweaking your daily routine, maybe implementing just very light strengthening exercise. And what I mean by that isn't like, grab a 35-pound kettlebell and, start doing shoulder presses with it. I mean more so what we call isometric holds, where you're applying pressure or tension to a muscle, but you're not necessarily moving it through a full range of motion. These things tend to be really good to help with pain relief. And then on the flip side of that, you should also be focusing on a very slow and gradual return to your normal activities. So if, for example, I treat a lot of CrossFitters, you shouldn't have this big acute injury and then 2 days later you're still in pain and go in and just blast through it with kettlebell swings, or if it's your low back, you probably shouldn't do super heavy deadlifts within that next day or so. You should take it a little bit easy and then start to reload those muscle groups or that irritated area. So if it's your back, maybe you're deloading for that week. Still work out, still move, but kind of take it a lot easier than you normally would. And then start to build that weight back up as your pain levels either decrease or start to completely go away. But I definitely think managing acute injuries, there's a number of different ways to go about it. And, from my standpoint, if a person isn't quite yet a patient and they're just saying, hey, I hurt myself 2 or 3 days ago, what should I do? I usually tell them wait about a week and then give me a call if it still hurts, to give their body a little bit of time to rest and then have some of that natural healing take place before I jump in and start kind of muddying the waters and doing some different treatments and interventions to it. What do you think, Craig?
That's I think that's great. That's the exact approach I like to take too. So I think you hit the nail right on the head there. From an educational standpoint with the acute stuff, I think when you kind of got into the inflammatory phase a little bit, I tend to try to educate people as best I can there. And this goes out to all the self-diagnosers out there who are listening, because
all the Dr. Googles.
Yeah, and I've done it. Prior to PT school, I was doing it. You bet I was doing it. Like something, I was like lifting and then my hip started to hurt. So I'm just like, Googling away like crazy, And I think there are two big things that kind of come to mind when I think of acute injury. And the first one is, like you said, the inflammatory phase. So and we'll get into this with a little chronic pain too, but I tell my patients kind of think of your body as kind of like a house. And your central nervous system is kind of the alarm system for that house. So if something bad happens, like let's say someone tries to break into your house, kicks the door down, of course the alarm system is going to go crazy. That's your body trying to protect itself. Pain is good in that sense because it's letting us know that maybe something has happened that should not have, kind of happened. So
right.
The pain response is very normal. So I typically tell people not to let them scare them or worry them. It's just your body is reacting in a very, kind of natural way. It's like I said, it's alarm systems going off, and that's kind of that inflammatory process. The brain is acting to protect itself, which is good. It's doing exactly what it should be doing. To kind of piggyback on that, in that acute phase, in that alarm going off phase, the alarm doesn't tick right off. It's not like you hit a switch, alarm goes down. There's going to be a couple days where it's not going to feel so hot. So if you do your Googling and say like, the number one sign for a rotator cuff tear is if I can't lift my arm up above my head, and you're still in the alarm phase, we'll call it, or this acute phase, and you can't lift your arm over your head, that doesn't necessarily mean your rotator cuff is torn. It just means that your body is kind of freaking out right now. And if you imply some of these, what you just talked about over the next week, there's a good chance that you can kind of restore a lot of good movement there. So I think educating on that pain doesn't always equal damage, especially in like the early phases, is important. Now, that's not to say that some acute injury absolutely requires, your surgical intervention or
Right.
going to the emergency room or seeing your doctor, but that's why healthcare providers like us exist. We can kind of sift through that. And the serious stuff is such a low percentage that
It's such a low percentage.
Way lower than people think. So that's why we exist to kind of catch the needle in the haystack, if you will.
Well, Dr. Google usually gives you the scariest things first.
Of course.
Before it gives you usually the common things that we see all the time. So, I see that a lot where patients will, in their mind, they're like, I need an MRI right now. Something's really wrong. I assess them and, things really aren't all that bad. Like in their mind, they're not able to do the things that they want to be able to do. But, when you compare what they're experiencing, to someone who actually needs to go to the emergency room for an injury, a lot of times they're not even close, but they've never actually experienced that before. That's a new thing for them. Kind of piggybacking off the alarm example, when things become chronic or when people have chronic pain, where the pain lasts for longer periods of time, way past that 1 to 2 week mark, what we tend to see with the alarm is sometimes a leaf will pass through and get in front of that alarm, or the alarm will pick up like a leaf blowing in the wind as if a burglar was trying to break into your house. So people may think or perceive pain, even though the stimulus that they're getting might just be like light touch, but the area is so sensitive that alarm is still going off. So sometimes when people have this chronic pain, they have a very sensitive alarm that really doesn't need to be sensitive. So they can have pain even though there is no tissue damage, like you said earlier. Anything you kind of want to speak to with how people who have chronic pain should go about moving or, kind of going about their day? Any good principles for them?
Sure. I definitely like using the alarm system analogy that you touched on there, especially the sensitized alarm. It's almost like the alarm is now geared up. It's almost like hypervigilant, almost ready to go there. So when we talked about earlier that there are 2 different ways about what to do after injury, this is the big one here. Even in chronic pain, we can still do our isometrics. We can still do our active rest if the pain does flare up to the point where activity needs to be modified. That is 100% true. But I think the biggest thing as far as recurrent or chronic pain is a graded return to activity. And I think that in the acute phase, that happens pretty quick. Especially if it's a new injury, if you're younger, if you're already physically fit, if you have a bunch of good stuff already going for you, then it makes that part really easy, if you will. But the game changes with a little more chronic or recurrent pain. Like you said, now your daily stuff might cause that alarm system to trip. So the important thing is realizing that pain doesn't necessarily equal damage. And when you do have chronic pain and it is kind of flaring up, you have to realize a couple things. First off, that's a pretty normal symptom. If you do have chronic pain, the likelihood of having a flare up for a limited time is not out of the question, and that's typically normal. That doesn't mean you need to seek special services. Hopefully you have in the past and someone has taught you how to self-manage it. And the key there is kind of initially almost treating it like a little bit of like an acute injury and then realizing you have to continue to exercise and grade your activity past that. So I don't know, do you have any advice you give patients there or any strategies you use for kind of like this graded activity? Because I think that's the key to the more chronic stuff.
Yeah, I love to use what I call the 2-point pain rule. So it's one way that I keep all my athletes training. And if I'm not seeing athletes, I use that same rule for housework or activities of daily living, things like that. The way the 2-point pain rule works is you rate your pain before you start to do an aggravating activity. So let's use deadlifts, okay, or picking something up off the ground. If we know that's going to be painful and it's something that you have to do, I'll ask my patient to think about what their pain level is before they do the task. And especially if they have to do a lot of it, like if they're a construction worker and they're bending over a lot, I have them rate their pain. Okay, let's say it's a 2. If their pain goes up to a 3 during the activity, you're good. Keep on going. You can kind of poke into that a little bit. If it goes up to a 4, same deal. Not a big deal. But if things get up to a 5, you run the risk of actually causing a little bit more irritation and then flaring up a condition. And then it might set you out a day or 2. So not necessarily that you're actually doing damage or more harm, in most cases, but more so you're just setting off that alarm, and that alarm is becoming even more sensitive, and it will last sometimes for a couple of days before it calms back down. So I think that's probably my number one way of getting people back to doing what they love as quickly as possible. Even during rehab, is we have to start to introduce the activity. We just have to do it maybe at a lower level, with less repetition, maybe bend or move a little bit of a different way that isn't so painful or aggravating, and then using that pain rule to help guide it.
Yeah, I agree with you. And one thing to add, if I can here, is I think with timing is important with the chronic pain. Like acute pain, we can kind of say like, you know what, we can put like a reasonable timetable on when we can expect to see maybe some sort of change. I'm not talking like you're going to go from feeling crappy to 100% better in this amount of time.
Right.
But in the acute world, you can be a little more precise, I guess you could say, when you're thinking about maybe how long you should see a change for the positive or for symptoms to resolve. But the chronic recurrent pain, it gets a little dicier there. It's pain that's been around for 3, 6, 12, 18, hundreds of months. I think the important thing to realize, if you took anything from our little talk there, is that it's going to take some lifestyle modification, and the time for positive results may be far out into the future. And I think it's a tough conversation to have, but it's a conversation worth having, because I think people tend to get frustrated a lot when things aren't becoming overly positive in like a short period of time. I think it's hard to say like, we're going to have to keep this up for a couple months to maybe even only see a little bit of positive change. And I think that can be tough.
A couple cases that really stick out in my mind, if I get a phone call and somebody says, hey, I'm in pain, this started 2 or 3 weeks ago. In my head, I'm thinking, oh, we're going to turn this around pretty quick. This is going to be a pretty quick rehab. They're going to be back to doing what they love super fast. And then on the flip side, I have, this, again, not to kind of say this in a funny way, but in all seriousness, I've had patients who sit in front of me and I say, how long has this been going on? And they say, look, I've been in pain longer than you've been alive. And so when you really think about that, if I'm having to reverse over 30 years of, a ramped up alarm system, it's going to take me a little bit longer to do that. Versus that person who's only been in pain for a couple weeks. And, like you said, lifestyle modification, changes to their daily routine, strengthening up the things that are weak, staying vigilant with their home exercise program. So people have been in pain a little bit longer. It is a little bit harder to calm down that alarm system and return things back to normal. So that's a pretty good point to make as far as, injury recovery. And we're going to get into when you should see somebody for help a little bit later, but that's kind of a good segue into our next topic, because we want to talk a little bit about what you absolutely should not do right after an injury. And there's a number of things, so I'll let you kind of take one of the first ones, and we'll kind of go from there.
Gotcha. So let's, just like we did before, let's talk acute versus chronic here. So as far as acute injuries are concerned, what should you not be doing? That's the big one. And I would say absolute rest is probably a bad one. I think protected rest and I think relative rest, great, perfect. But I would say absolute bed rest. Like that's like the old school, like you went to the hospital back in the day and you just like weren't lifting a finger for like weeks. Sounds awesome sometimes, I could go for that every now and again, but as far as tissue healing is concerned, probably not a great idea there. And I'll kind of talk on the big ones here, like resorting to like immediately I need I need a high strength pain. I need an opioid painkiller. Like I had surgery in the past and they gave me oxycodone and I stashed a couple in my medicine drawer. So I got to bust those out now. I've heard that many times. Or like, my neighbor had their wisdom teeth out and they have some like spare painkillers. So I took some of those. Absolutely not needed. Like we said, that's just the alarm system doing its job. And there is likely no major damage going on. So you don't have to, rely on these super strong dose painkillers. And that goes the same with other surgical, interventions. Like a lot of times people come in and they say, a couple days ago, I was out working in the yard. picked up a really heavy bucket. Now my shoulder feels like it's on fire. Like I need to go get a cortisone injection. I tore my rotator cuff. I need to go have surgery. And I think that is tough, because if you have no medical background, your first instinct is like something terribly bad has happened, when in reality, sometimes you just need to follow some of the should do's that we talked about earlier, and things tend to get a little bit better. So from like a mental standpoint, I typically tell people that, likely the odds of something very serious happening pretty low. It's our job as medical professionals to pick out the very serious ones. And if you got to me and I can confidently say nothing's going on, then you've probably seen enough people to hopefully put your mind at ease there. So
Right.
Any other things that you would recommend not doing for acute stuff?
So a couple other things. I would say, kind of piggybacking off the surgery thing that you mentioned, a lot of times people get some sort of shoulder injury. They're doing something in the gym. They lift something just the wrong way overhead, and then it starts to aggravate their shoulder. The first thing that they think of is, I need to have this scoped, or I need to go to a surgeon. And a lot of times they go to a surgeon, and, the indications for like a shoulder scope, they kind of call it like a cleaning out procedure. But as far as actually cleaning stuff out, most of the time it's not necessary. It's one of those things where if you've tried physical therapy and you've tried to reload the tissue and make your rotator cuff stronger, make your scapular muscles stronger, that all these things get weak especially after an acute injury, and something that's even a little bit more chronic will find weakness in those muscles. If they're not reloaded, you're not getting out of pain, especially if this has been going on for a long period of time. So it is really important to at least try the strengthening method. A lot of times people try to DIY their physical therapy or go to YouTube for stuff. It's kind of the same thing as Dr. Google, right? But at the end of the day, surgery should always be your last resort, should always be your last option, because once somebody has their anatomy changed, even if they're just cleaning out tissue, they respond differently to the hands-on techniques that we do in therapy. Somebody who had a shoulder scope does not respond with the same techniques that I would do as somebody who has not had a shoulder scope and kind of has their original anatomy. Don't understand exactly why, but clinically it's just something that we see. It's a different outcome, and that patient's body responds differently to the care that we provide. And then, kind of moving off of surgery, I think the other thing that people should probably be cautious about is the tough it out method. And, I see this all the time in CrossFit gyms. And it's not the gym's fault. And it's usually from a member standpoint. The person who's injured, they just aren't sure what to do or where to go, or maybe they've seen somebody and they didn't get the results they were looking for, so they just figure, I'm just going to keep doing what I was doing and it'll just go away. And I would say probably a good majority of injuries will go away on their own, but usually they'll go away within that first 1 to 2 weeks. If they're still lingering past that and you're pushing through pain on pull-ups or handstand push-ups or overhead squats, whatever it is, it's probably not going to spontaneously just magically go away on its own. So people who are toughing it out, they're just making that alarm system more sensitive. So the more sensitive that gets, again, the longer it takes to heal when it comes to therapy and some of these other methods out there that you might try to use to get pain relief.
So with that in mind, you kind of talked about it there. We'll kind of move on to maybe some things you shouldn't do for, let's say, like a chronic or a recurrent injury. Any advice there?
So if somebody has a chronic or recurrent injury, I think the biggest focus needs to be spending time thinking about the activities that you need to modify. So it's more of the should do's from the what you should not do standpoint. Like I find that a lot of patients with chronic pain, they jump right into passive treatments. By passive treatments, I mean where things are being done to you instead of you doing the work. Passive treatments can be anything from massage to adjustments to dry needling to TENS units and electrical stimulation units. Different things like that, where you're just kind of laying on a table or you're laying in one spot and things are just happening to you. The way that we decrease that alarm system is primarily with active movement. Now, it's not that passive treatments are bad, but they're usually not all that helpful for people who have chronic types of pain in and of themselves. So if you're just receiving passive treatments or just getting massages, if you're just getting adjustments, if you're only getting dry needling, and there's no active strengthening like type of rehab component that's going on, your results are probably going to be short-lived and you're just going to get short-term pain relief. I get patients all the time who come back and they say, hey, I've been, going to, a massage therapist or, a chiropractor, and, all they do is, their treatment or their passive treatment. And then after that, I feel great for like 1 to 2 days and it's right back where it was. And there's nothing against those providers or anything like that. It's just the world that we live in from an insurance standpoint. It's really hard for providers to have the time to do all of these different things with people. So it's it's a situation where I see it pretty often and patients don't get the result they're looking for. And then we start to add in some strengthening and some targeted tissue loading. And next thing you know, that patient's responding beautifully. And they also have some exercises and some things that they can take home with them. So I guess long story short, what you probably shouldn't do is have only passive treatments in your back pocket. Make sure that you're seeing somebody who at least knows how to load specific tissues, or is at least giving you some exercises or active movement to do on your own time. Anything you want to add to that?
I think those were all great pieces of advice there. And I completely agree with you about the passive stuff. Typically in my style of treatment, I'll use passive modalities in the interest of following it up with an active sort of treatment. Like I'll do something passive if it can promote better active movement. And I think that's the key for anyone listening out there. My one just little extra thing to add, my biggest what not to do in the chronic pain world is I'll tell patients, don't forget about the big picture, right? So when I say big picture, I mean just overall health and wellness. In our world, we call it the biopsychosocial model, which is just like a big fancy word for kind of the complete picture. PTs, we're a part of that picture, but it's also our job to help you navigate through the rest of it and get you into the other places you need to be. We use the alarm system analogy a lot here, but it's way more complex than that. That's just the best way we can describe it in the most simple way. Once pain lasts for 3-6 months and longer, something happens. And I don't think we're really good. Anyone, myself included, is great at understanding what happens, but when it is addressed, as a whole, you need to be addressed. So of course it's the movement-based stuff. Of course it's the passive stuff. And if you are on various medications, that's definitely okay. But people tend to forget about the other things. Like, is your job stressful? Are you in a stressful relationship? What's your diet looking like? Are you consistently sleeping? Are you doing things like breathing exercises, meditation? Can you find ways to de-stress? Like that little stuff, the stuff that typically gets swept under the rug or the stuff that doesn't typically get addressed is like super important. And it's not our job here to give you nutrition advice, or I'm not going to teach you. I'm not, certified to teach you in yoga or meditation. But what I am, able to do is say, like, what, this is some stuff that people typically don't think about or think matters. And that's the key, is realizing how important it is. And it's like, as like a person, you got to make a positive change from all ends. It's not just like you're putting it in the basket of this is my muscle pain, and this is what I do for that. It's got to be like, as a person, I got to start looking in there and seeing how I can get a little bit better. Not to get too deep there, but I think that's sometimes that gets forgotten.
Oh, absolutely. Absolutely. So in your opinion, Craig, let's say you have a friend or a family member, they suffer an acute injury. So it's kind of fresh. It's been going on for maybe 0 to 7 days. And then, you maybe jump on a quick phone call with them. You're like, hey, take it easy, maybe slow down some of the things that you're doing at home, or, change your workout routine a little bit, give it a little bit of time to heal. They continue to have pain. When do you feel the right time is to get help?
I think that's a great question. And if we're focusing just on the acute stuff here, first off, if to anyone listening, if you don't have any access to like a a friend in the healthcare field or whatever, I'm still a big proponent of doing what we talked about earlier for maybe about a week. Our active recovery, our active rest, our graded return to activity. And if you're not seeing noticeable positive results, I would go in and get it checked out, whether that be your primary care. Obviously, I'm biased. I'm going to tell you to go see a physical therapist. If it's movement based, we're going to be the ones that help you. But that's when I would, and if you have your buddy that's like PT and they know what they're doing, and you try some of this stuff and a couple of weeks go by and you're like, you know what, it doesn't feel like it's quite right, or I feel like I'm about the same. That's when I would kind of like, all right, we got to call a cavalry in here. We got to get something done about this. And not only to resolve the pain, but if it's something that you feel like is a definite aggravator, then you can kind of change your mechanics so it's it's not happening again, kind of deal. So any thoughts on your end with that one?
Yeah, it's kind of funny because sometimes patients that are new to me and how I practice, in their mind, they continue to just live with pain for so long. And then sometimes for them to take that initial step to say, you know what, I need to get help for this. They need a little bit of a push, either from family, from friends, or, maybe it's just one big workout that they really wanted to be able to do. And then, their shoulder or their back, it just kind of blew up on them. The pain did. So I usually tell people, if you've been having pain for longer than 1 month, the chances of it going away on its own with you doing the same stuff that you've been doing and not changing any behavior or modifying anything, slim to none. Okay. Some people get better. Absolutely. But after that 1 month period, if you've tried a whole bunch of stuff and you've thrown paint at the wall and nothing's changed, go get it looked at. And even if it's at least for one visit to get the guidance, I definitely have some patients who are super independent with home programs and things like that. They'll get pain within 2 weeks. They come see me for one appointment, and then I get them on their way because now they know what's wrong. They know what's going to aggravate it, and they know they have some guidelines on things that they need to do to treat and fix it. So it's, I guess, like the idea that people sometimes have a physical therapist is, if I go see one, I'm going to need like 20 visits. But in all reality, we give you what you need when you need it. And sometimes all you need is just 1 or 2 visits, and that's it. And that's exactly what we give you, or at least what I give them. So is there anything else you want to kind of add to that?
I think if for the patients listening, just be your own advocate with that kind of stuff. Because if I'm way more likely, if a patient came in, sat down and said, you know what, I tweaked my shoulder the other day, it hasn't been getting better. Like, can you just give me some advice or some things to do? I'm more likely to, realize that person is a little more independent, and it doesn't have to be a long plan of care. I think you said it perfectly. Like, people, when they go to PT, they expect it to be some long, drawn out thing, when in reality, if you're kind of, just tell us exactly what you're looking for, like, we tend to accommodate that. But you have to be your own advocate, in some respects.
No, that is so true. So with that being said, is there anything else that you want to leave for our listeners before we get off here?
I guess so when to seek help with a little more chronic pain, I guess, is something worth talking about. Is if you've had pain for a long time and you have never been to a physical therapist, then I would say, you need to get in there. I think that's a big key component that's missing. That doesn't happen very often, but there are plenty of times where I've met people say, you know what, I've had back pain on and off for the past year, and this is the first time I've seen a physical therapist. That's pretty rare nowadays. But I would say if you fit yourself into that group, I would reach out and I would see one. But let's say you've seen maybe a PT in the past, massage therapist. You've ran the gamut of conservative stuff. I think every so often, when I say every so often, maybe every 3 or 6 months, it might not be a bad idea to go and just kind of check up with somebody. Maybe it could be activity modification. Maybe it could be, hey, you know what, this new research came out, or hey, I learned about another practitioner who's really good at this. Or if you listen to our first episode, every PT is a little bit different about how they, go about things. And maybe you just find yourself, a little better fit. I think in the chronic and recurrent pain sort of theme, I think number one, it's motivating to go to PT. Like, we want to help you, and sometimes it helps keep you in that right mindset. But I kind of think of it like the dentist, like, you're supposed to go get your teeth cleaned every so often just because it's like good for you. I think if you have, recurrent or chronic pain, just kind of having someone to talk to or learn some basic techniques or learn some new stuff just every so often to kind of keep yourself in check and keep yourself, self-managing. I think that's valuable.
Yep. That's great. So just to recap on my end, so things that you should do if you have an acute injury, so a new injury, you can use the price method and just take a graded return or a slow return back to the things that you were doing before. If you have a chronic injury, something that's been lasting a little bit longer, you should probably seek help if you haven't already from a physical therapist or some sort of medical provider who is comfortable dealing with chronic pain. Modify some of your activities, take a slow return back to some of the things that you do enjoy doing or things that you want to get back to. And remember that pain doesn't always equal damage. Things that you should probably avoid doing or that you definitely should not do, especially if you have an acute injury, you should not completely put yourself on bed rest. Try to avoid resorting to painkillers, injections, surgery right off the bat. The tough it out method, in both of our experiences, just has not found to do patients very well. And usually they end up seeing us anyway. So if you're unsure, you're currently toughing it out, consider giving your local physical therapist a call. You should also try to avoid passive treatments, not completely, but make sure there's an active component going along with them. The time that you should probably consider to see a physical therapist would be about maybe 1 month after having some pain. And even if you go in for at least one visit to say, hey, what do I have going on here? Is there any way that I can manage this, on this specific budget, or with only, I have a lot going on in my life, one visit a week, something like that. So with that being said, thank you guys so much for tuning in to the Straight-Talk Physio Podcast. If you like what you're hearing, it would mean the world to us if you subscribe to this podcast and the Peak Physiotherapy and Performance YouTube channel. For more information about us, please check us out on Facebook at Peak Physiotherapy and Performance and on Instagram at P3 Physiotherapy. Thanks again for watching, and we hope you guys have an awesome day.